Our report this year has a number of positive findings, and that's important at a time when staff working in mental health services are feeling under considerable pressure. We found that there has been a fall in the number of patient suicides overall, and a fall in specific patient groups: inpatients, people recently discharged from hospital, and people who have stopped taking their medication. Even people under crisis resolution teams, that's a group that we've been concerned about previously, their numbers have gone down a little bit in the most recent year. Having said that, there are still reasons to be concerned about the number of people who die, particularly under acute mental health care. Although inpatient suicides continue to fall, the rate at which that fall occurs has declined. So over our 10-year reporting period, in the first 5 years, inpatient suicides fell by 39%. In the most recent 5 years, it was by 10%. It is slowing down. The improvement is slowing down. And we now have around 90 inpatient suicides in England, over 100 in the UK as a whole each year. When it comes to people who die after hospital discharge, although the numbers have fallen, the pattern that we previously reported is still there. The maximum risk in the first week after discharge, with a peak on day 3, a predictable time when services could intervene and prevent. And then, of course, there is the overall figure. The number of patient suicides may be falling, but across the UK, in our most recent year of 2015, there were still 1,538 people who died by suicide under current or recent mental health care, and that is too many. This year we also looked at diagnoses that are less common in patients who die by suicide. Of course, the figures are dominated by patients with depression or schizophrenia, but we looked this year at patients who had different diagnoses: dementia, autistic spectrum disorders, and eating disorders. And in those conditions, there were around 20 deaths per year on average during the report period. But the important thing is that those figures are increasing. Now, the increase may be because those conditions are diagnosed more often, but it is a reminder to clinicians working in those areas that there is risk in their practice too, and that as frontline clinicians we need to be constantly vigilant.